Welcome back to another episode of the Secrets of Beauty and Wellness. I am your host, Dr. Ayala from Golden Rose Wellness and Mespa, and today we're going to talk about a topic that I get questions all the time, and it's about biostimulators, what it is, what are the brands, what do they do, when should I do it, it is fillers. It's just so many questions, so I kind of figure, let me just sit down, let's talk about it, let me break it down so it's easier to understand for you as a consumer. So first thing first, biostimulators are not filler, and we need to have that very clear because people confuse both of them. Dermal fillers, which is hyaluronic acid, are made to give instant plump and instant volume. With biostimulators, that doesn't happen. So in the United States, there are 3 FDA-approved biostimulators. We have Sculptra, we have Radiesse, and we have Bellofield. I don't carry that one specifically because it comes from bovine and I don't like the whole situation. So these are the 2 that I really like, that I think really good results, and they're amazing. So first thing first, let's talk about Sculptra, because Sculptra has been in the market way longer than Radiesse. And the first FDA approval that we got for Sculptra wasn't for the aesthetic industry at all whatsoever. This was for a study and FDA approved for HIV patients. So if you remember, HIV back in the day, they were very cachexy. They were losing a lot of fat in their faces, in their body, and they decided to study this polyitic acid to see what would happen if they could get their volume into their faces back again. And it did. So they got the FDA approval. So Sculptra is polylactic acid. It is made for the same materials that your sutures are made. So it is dissolvable. Sculptra, we have to mix it. So when you get Sculptra, it comes in a powder like this, and we have to mix this product with bacteriostatic saline and lidocaine to be able to inject it, because you can't inject a compressed powder. So we have to dilute this. Now, when Sculptra it is made, we use bacteriostatic saline or sterile water, either or is perfectly fine. And then I like to use lidocaine to make it a little bit more comfortable for patients when they're getting the injection. So the rule of thumb for Sculptra is that you need 1 vial per decade of life. So that means if I am in my 30s, then I need 3 vials. If you're in your 60s, then you need 6 vials to get the results that you're looking for and that it was studied. But that doesn't mean you need to have 6 vials at once, and I would never do that. If you go to an injector that says you need 6 vials in one sitting, just run away. That's a red flag right there. So I like to break it down. So I always like to do 2 if it's something you can afford, because if we just do 1 in the beginning, you're just not gonna see result. You're going to give up and you're gonna say, nah, Sculptra doesn't work. Trust me, it does work. It's beautiful results. So we'll do 2 vials, we get it ready, and then we inject. A lot of people are afraid of Sculptra because they have heard in the past that it can cause nodules that are very hard to get rid of. And yes, that is a risk. Remember, Sculptra is a biostimulator. It's stimulating collagen type 1. So yes, there is a risk of nodules formation, but it doesn't really happen as much in 2025 because we have changed the way we get ready the product. So back when it first came out, I believe you have to dilute it with 4 or 5 cc's of bacteriostatic saline. What we know now is that using 5 cc's is not enough to make sure you don't get any nodal formation. So what we do now is we dilute it with 8 cc, some up to 9 cc's, and then I put 1 cc or 2 cc's of lidocaine. We get it nice and ready, and then it's ready to be injected. So this is not going to give you instant volume. Of course, this is going to stimulate your own collagen production. Now, I think it's important to keep in mind that if we do Sculptra, but you don't take care of yourself, you are a smoker, you live an unhealthy lifestyle, then you're not going to have optimal results, and then you're gonna think Sculptra is just not gonna work. We need to stimulate collagen. We need to tell our fibroblasts to stimulate collagen. But if you don't feed your fibroblasts correctly, you're not going to stimulate collagen. And I think that's why a lot of people say that they don't see results with Sculptra, is because they don't understand the fibroblast part of the collagen stimulation process. Let me break that down a little bit more, because this can sound Chinese for some people. When you inject Sculptra, you're injecting that polyitic acid into that dermis to dermis part of your skin where the fibroblasts live. If you inject Sculptra in the muscle, nothing is going to happen because the fibroblasts are not in the muscle. If you inject Sculptra down into bone, fibroblasts are not there. However, there's data and there's research that Sculptra is stimulating bone growth. That's still in research. Don't quote me on that. I'm not an expert on that, but it's out there. And Dr. Shinobe, if you guys know who he is, he talks a lot about this, and he has said that yes, in research, there has seen that there's bone stimulation with Sculptra. Now, I don't place Sculptra, I don't like to do it down to bone. I like to put it where the fibroblasts are living, because fibroblasts are responsible for producing your own collagen. Now, the tricky part of this is, what if your fibroblasts are lazy? You're not gonna see results either. And that's why I get a lot of patients coming in consult saying, I did not see results. But I always ask, what else did they did with your Sculptra? They just did plain Sculptra, or they actually give food to your fibroblast? If they don't give food to your fibroblasts, you might not have, optimal results with your Sculptra. So the way I do it in my practice is I give nutrients to those fibroblasts so they can do the job correctly. And that's how you see amazing and beautiful results on the patients. Now, you're not gonna see results immediate. And that's why some people don't want to do Sculptra or any type of biostimulator, is because it's gonna take a couple weeks. You might start seeing results by week 4, maybe week 6, but the optimal results, you're gonna see it about 3 months, 12 weeks down the line. So Sculptra is for someone that wants natural results, that don't want to look overdone or overfilled. I think we're just moving away from that trend of overfilling people's faces, and they're looking into more natural outcomes, and that when Sculptra plays a big role. Now, I'm not saying anything against filler. Fillers, I love them. I use it every single day, even in conjunction with Sculptra, because that's how I do a good facial harmonization, but that's another podcast. Going back to Sculptra, it works, it's beautiful. You need to have patience, really, really important, because otherwise you're not going to see results with it. Now, Radiesse. Radiesse is my baby, and if you've been following for a while, you know that I love Radiesse, and here is why. We know that Sculptra stimulates collagen production, which is fine. It doesn't give you any immediate volume, but Radiesse can. And that's the beauty of it. There's 2 ways to do Radiesse. If you want Radiesse to act like a filler, meaning giving you volume and structure that Sculptra can do, but I still love it, then we have to use it exactly how it comes in the box, in the syringe. It literally comes in a syringe. In contrary to Sculptra that comes in a vial that has to be mixed, this is ready to be injected if you want it to act like filler. Now, why does the act like filler? So Radiesse is calcium hydroxyapatite, meaning it can mimic bone. So if we use it that way, it can literally replicate bone. I can use it as is for chin, cheeks, jawline. It is absolutely beautiful because you're adding volume as a filler, right? But you're also stimulating collagen. So you have the best of both worlds. I have Radiesse. I have 2 syringes of Radiesse on my face, and it is the best thing I ever done into my face. So if I want to use Radiesse just as a collagen stimulator filler, then I will have to hyper dilute it because Radiesse as it is so strong. It's calcium, right? So if I want to use it to kind of put, let's say, in the lower face, or if I want to do it on the neck, it's beautiful. It goes nicely as a blanket of collagen, and you see results quicker than Sculptra. But I still love Sculptra. I think that's important to say. Now, Radiesse is a syringe. We can hyper dilute it depending. We can do 1 to 4, 1 to 3, 1 to 5, depending on what's exactly what I'm trying to do and what is my goal for my client. If I have, let's say, a female patient with very kind of thin, crispy skin, then I'm always going to recommend to do Radiesse, but to do it hyper diluted, like a 1 to 5. And then it's like I'm putting a blanket of collagen in the neck, and you get such good results that you might not even need a second treatment. So what makes Radiesse different from Sculptra is that Radiesse stimulates collagen type 1 and collagen type 3. Now, I know there are a lot of injectors that don't like to use Radiesse because, God forbid, you have a complication, nothing will dissolve Radiesse. And it's really hard to get rid of it. Sometimes we even have to send you to surgery to get it surgically removed. Now, that doesn't happen if you go to a well-trained injector that spends thousands of dollars every single year training, like me. So that should not happen. But some injectors are afraid of it because you can have bad results with it. Now, like I say, it's beautiful. You see results almost immediate, and you don't have to do 6 vial or 5 syringes. You don't have to do any of that. If I dilute it with bacteriostatic water, I can do maybe 2 syringes, half and half, and that's more than enough. Then I'll bring you back in a couple of weeks just to see how everything is doing. And then at that time, then I'll decide if you need another round of treatment. So Radiesse is really my go-to for thin, crispy skin on the neck. It is also my go-to if you need some structural support, like to enhance your cheeks, if you need some chin support, if you need some jawline support, then it is amazing. Now, I don't use it on everybody. It has to be someone that can tolerate using this type of product, and it is only FDA approved to be used in the areas I mentioned. Don't you ever go to an injector that tells you, let's use a biostimulator under your eye, like Sculptra and Radiesse. That's a no-no, that's a red flag right there. And biostimulators cannot be used on the lips either. I've seen some crazy stuff in social media, and I don't know how people are injecting this in the lips because that's a nightmare. You're asking for trouble. So no, it is not FDA approved to be used on those areas. I love it. I think it's amazing, and I will always use it. Now, who is not a candidate for biostimulator? It doesn't matter if it's Radiesse, it doesn't matter if it's Sculptra. There is a rule of thumb that if you have autoimmune conditions like lupus, Hashimoto's, rheumatoid arthritis, that we can't use biostimulators. Now, take that with a grain of salt, because it's not that you can't, it's that your condition needs to be completely under control. If you come here and you say, I want Sculptra, and then I ask you, do you have any autoimmune condition? And you say, yeah, I have hypothyroidism. Then I have to ask you, okay, what type of hypothyroidism do you have? Is it autoimmune, meaning Hashimoto's, or is it like surgical, acquired hypothyroidism? Because if it's Hashimoto, I need to make sure you're under control. So even if I'm not your endocrinologist or I'm not managing your thyroid, we might have to send you for some blood work, or you need to show me your recent blood work that shows that your condition is totally under control and that you're not actively having symptoms of a flare-up of your condition. And the reason is, these are biostimulation. How do they act? Sculptra specifically acts by creating inflammation in your body, and that's how your body produces collagen, by reacting to that inflammation. So if you have an autoimmune condition and you do get Sculptra, then I can make that condition worse. I can have you have a flare-up, and that's just not fun to have to deal with. And it happened to me once and only once, and it will never ever happen to me again, when I had a patient that admitted that she had an autoimmune condition. And then a couple days later, she called me that she was feeling bad, that she just wasn't feeling like herself. And then she was having high temperature. I think her fever was like 106, 105. I said, you're going straight to the hospital. Because the first thing I thought, it was, she has an infection. Like, what did I did wrong? Didn't I just clean? Like, what happened? And I brought her back, we met, and I said, I saw no signs of an infection at all. I touched her, no signs of an infection. And then I have to kind of go down this list, and I say, do you have an autoimmune condition that you never disclosed with me? And she said, yes. And that's when I say, okay, this is a flare-up of an autoimmune condition. Let's just give it time. Let's keep you cold. Let's give you some acetaminophen, and you should be fine. And she was fine. But this is something that we need to understand. These medications work by creating inflammation. And if you have an autoimmune condition, that autoimmune condition can wake up and have a flare-up. But overall, anybody can use this type of biostimulation. I do think everybody can benefit from using biostimulation. It doesn't really matter what your age. If you're in your 20s and you want to have Sculptra, sure, let's do it, because we're preventing. We're making sure that we don't get to a point that we need to go have a facelift. And I have had clients come in here wanting Sculptra, and I said, you need to have surgery. And I'm going to tell you, if you come here with unrealistic expectations, and if you come here showing me a picture that you saw on social media, and it's from someone that is 40 years old, and you're 75 years old, and you're wanting me to do Sculptra so you look like this person, then I'm just gonna say, I'm sorry, I'm not gonna be able to meet your expectations. I would rather if you go and have a facelift. And then after you go and have your facelift, then come back. And then we'll do Sculptra, we do Radiesse, we do anything you want, just so we can maintain the results that you got with the facelift. But I think it's important to not have that expectation that this is going to kind of take over having surgery, because that will never going to happen. So how do you take care of your results? Really, really important. Skincare is extremely important, and you will always hear me say this. What's the point of investing in these procedures and treatments if you're not going to take care of your skin at home? It's 20% what we do here, is 80% what you do at home. So if you're gonna invest in this or tox or whatever it is, then I want you in the basics. Vitamin C if you're not allergic and if you don't have acne. Otherwise, I want your niacinamide as an antioxidant, and I need you on a retinoid or tretinoid prescription strength and a good SPF. That is basic for everybody. It doesn't matter if you're getting into aesthetic or not, that those are basic ingredients for healthy skin. So I hope this episode answered a lot of the questions, and if you have any questions or any concerns, just leave them below. I'll be more than happy to answer them. And thank you for listening to another of my episodes, and I'll see you the next time.